Dear colleagues, welcome to day 3 here in ESMO 24 Barcelona. We proudly bring you this OncoAlert roundup of day 2, and please note that these are just some of our picks, so if you would like to dive deeper into the trials, just sign up for our newsletter in the link that can be found in this post, or just go to www.oncoalert360.com. That's www.oncoalert360.com. So before we start, a huge thanks to all of our colleagues who participated yesterday in the OncoAlert 5K, and a huge thanks to Bayer for the support of the 5 Catalyst Fellowships that we have now released here at ESMO and will benefit colleagues at LMICs. So starting off with 2 concomitant publications. First off, out of the New England ponsegromab for the treatment of cancer cachexia. In a phase 2 double-blind trial involving patients with cancer cachexia and elevated GDF15 levels, ponsegromab, a GDF15 inhibitor, significantly improved body weight, appetite, physical activity, and cachexia symptoms over 12 weeks compared to placebo. And out on the Lancet, the ENGOT-CX11 trial, pembrolizumab or placebo with chemoradiotherapy, followed by pembrolizumab or placebo for newly diagnosed high-risk, locally advanced cervical cancer. At the second interim analysis, pembrolizumab significantly improved overall survival with a 36-month survival rate of 82.6% compared to 74.8% in the placebo group. These findings, along with previous progression-free survival results, support pembrolizumab chemoradiation as a potential new standard of care for this patient population. And now on to some great presentations out in the presidential. Starting with GU, the PEACE-3 trial, and randomized multi-center open-label phase 3 trial comparing enzalutamide versus a combination of radium-223 and enzalutamide in asymptomatic or mildly symptomatic patients with bone metastatic castration-resistant prostate cancer. And here, PEACE-3 shows that adding radium-223 to enzalutamide significantly improves radiological progression-free survival and interim overall survival in men with metastatic castration-resistant prostate cancer with manageable adverse events. Moving on to GI, the Podium 303 trial shows that adding retifanlimab to standard chemotherapy significantly improves progression-free survival in patients with locally recurrent or metastatic squamous cell anal carcinoma with favorable safety profile and potential to become a new standard of care. The next GI trial is the LEAP-012, which demonstrated that lenvatinib plus pembrolizumab combined with TACE significantly improves progression-free survival in intermediate-stage hepatocellular carcinoma with an early trend towards better overall survival and a manageable safety profile. In lung cancer, the MARIPOSA-2 study, amivantamab plus chemotherapy, numerically improved overall survival and significantly extended progression-free survival after subsequent therapy in patients with EGFR mutant advanced non-small cell lung cancer post-osimertinib. The next lung trial is a CRYSTAL-12 trial. Adagrasib, a KRAS G12C inhibitor, significantly outperformed docetaxel in improving both systemic and intracranial efficacy of KRAS G12C mutated non-small cell lung cancer patients, including those with baseline brain metastasis, despite similar rates of treatment-related adverse events. And ending with breast cancer with a positive trial, breastfeeding in women with hormone receptor-positive breast cancer who conceived after temporary interruption of endocrine therapy. The trial saw that nearly 2/3 of women with hormone receptor-positive early breast cancer who gave birth breastfed without impacting their breast cancer-free interval or increasing breast cancer events. And there you have it, folks, your day 2 roundup. We thank you for your support, and we look forward to a wonderful day 3 here in beautiful Barcelona.